Today's video topic is, what causes tingling or numb sensation in your feet? Tingling or numbness in your feet, medically known as paresthesia, can feel like pins and needles, prickling, or a kind of crawling sensation. Sometimes it's just mildly annoying, like when your foot falls asleep from sitting in one position too long. Other times it can be more persistent and even painful, impacting your daily activities and overall quality of life. Understanding what's happening in your body when you experience these sensations can help make sense of them. So, what exactly is happening when your feet tingle or feel numb? Well, these sensations are related to your nervous system, which is your body's communication network. When everything is working correctly, nerves send signals from your feet to your brain about what you're feeling: warmth, cold, pain, touch, and so on. When these signals get disrupted or distorted, you might experience tingling, numbness, or other unusual sensations. The nervous system consists of two main parts: the central nervous system, which is the brain and spinal cord, and the peripheral nervous system, which is the network of nerves outside the brain and spinal cord. The peripheral nerves are like the body's telephone lines, carrying messages to and from different parts of your body. When something goes wrong with these nerves, it can result in paresthesia. Symptoms of tingling and numbness in your feet. When people talk about tingling or numbness in their feet, they often describe a variety of sensations. Tingling, often described as pins and needles, is one of the most common sensations. Imagine the feeling you get when your foot falls asleep. This tingling can vary in intensity. It might be a faint, barely noticeable sensation, or a more pronounced, almost buzzing feeling. Some people describe it as if tiny ants are crawling over their skin, while others might compare it to the prickling of 100 tiny needles. This sensation can be localized to a small area, like a single toe, or spread over a larger region, such as the entire foot or even up into the leg. Numbness, on the other hand, is a loss of sensation. It can feel like your foot is wrapped in thick padding or a heavy glove, dulling your ability to feel touch, temperature, or pain. This can make it difficult to walk or even stand, as you might not be able to properly sense the ground beneath you. Numbness can lead to a sense of disconnection from the affected part of your body, as if it's not quite your own. In addition to tingling and numbness, some people experience burning or stinging sensations. These can feel like your foot is on fire or being jabbed with sharp objects. This type of pain is often described as intense and persistent, sometimes worsening at night and interfering with sleep. Causes of these sensations. There are numerous potential causes, ranging from temporary issues to chronic conditions. One of the most common and benign causes is poor circulation or prolonged pressure on the nerves. Ever sat with your legs crossed too long and felt that tingling when you stand up? That's because the pressure on your nerves or blood vessels temporarily disrupts the normal signaling or blood flow, causing that pins and needles feeling. Once you relieve the pressure, circulation improves and the sensation usually goes away. However, if the tingling or numbness persists, it could be due to more serious underlying conditions. These include: number 1, diabetes. Diabetes is a major cause of chronic numbness and tingling in the feet. High blood sugar levels can damage the peripheral nerves, leading to a condition known as diabetic neuropathy. This type of nerve damage can cause persistent numbness, tingling, pain, and weakness in the feet and legs. Number 2, peripheral artery disease. This is a condition where the arteries that supply blood to your limbs become narrowed or blocked. This reduces blood flow to your feet, causing pain, tingling, or numbness, especially during physical activity. Number 3, vitamin deficiencies. Vitamin deficiencies, particularly vitamin B12, can also lead to tingling and numbness in the feet. Vitamin B12 is essential for nerve health, and a deficiency can cause nerve damage, leading to these sensations. Other nutritional deficiencies, like a lack of vitamin E or B6, can also contribute. Number 4, nerve entrapment or compression. This happens when a nerve is pinched or compressed, often due to repetitive motions or certain medical conditions. Conditions like carpal tunnel syndrome are well-known examples, but nerves in the feet can also be affected. For instance, tarsal tunnel syndrome involves the compression of the tibial nerve as it travels through the tarsal tunnel near the ankle, leading to pain and tingling in the feet. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Certain infections and autoimmune diseases. Some infections and autoimmune diseases can also cause nerve damage and subsequent tingling and numbness. For example, Lyme disease caused by tick bites can affect the nervous system if left untreated. Autoimmune diseases like multiple sclerosis and lupus can also lead to nerve inflammation and damage, causing a variety of symptoms including paresthesia. Number 6. Alcohol. Chronic alcohol abuse can lead to nutritional deficiencies and directly damage the peripheral nerves, which is a condition known as alcoholic neuropathy. This can cause pain, tingling, and numbness in the extremities, particularly in the feet. Number 7. Medications. Certain chemotherapy drugs, antiretroviral drugs used to treat HIV, and some antibiotics can cause peripheral neuropathy as a side effect, leading to tingling and numbness. Number 8. Injuries. Injuries that affect the nerves, such as fractures, herniated discs, or severe trauma, can also result in these sensations. If a nerve is damaged or compressed due to injury, it can disrupt normal signaling and lead to paresthesia. So, when should you talk to a doctor about tingling or numbness in your feet? If the sensation is fleeting and clearly related to a temporary situation, like sitting in one position too long, it's usually not a cause for concern. However, if you experience tingling or numbness that doesn't go away after a few minutes, it's a good idea to consult a doctor. Symptoms that gradually worsen over time are another red flag. If the tingling or numbness is accompanied by other symptoms like pain, weakness, difficulty walking, or changes in bladder or bowel control, it's important to seek medical advice. These could be signs of an underlying condition that needs treatment. Treatment of tingling and numbness in feet. Treating tingling or numbness in your feet at home can be effective, especially when these sensations are caused by temporary or less serious conditions. While home treatments might not be a substitute for professional medical advice, they can certainly help alleviate symptoms and improve comfort. One of the simplest ways to address tingling and numbness is to be mindful of your posture and movement. Avoid sitting or standing in one position for too long. If you work at a desk, make sure to take breaks to move around and stretch your legs. When sitting, avoid crossing your legs to prevent compression of nerves and blood vessels. Applying a warm compress to the affected area can also help improve blood circulation and relieve numbness and tingling. Use a warm, not hot, heating pad or a warm towel and apply it to your feet for about 15 to 20 minutes. This can help relax muscles and reduce nerve compression. Soaking your feet in warm water with Epsom salts can also provide relief. Epsom salts contain magnesium, which can help reduce inflammation and muscle cramps. Dissolve a cup of Epsom salts in warm water and soak your feet for 15 to 20 minutes. Other than that, engaging in regular physical activity can improve circulation, strengthen muscles, and reduce the risk of nerve compression. Low-impact exercises such as walking, swimming, and cycling are particularly beneficial. Aim for at least 30 minutes of moderate exercise most days of the week. Now, we want to hear from you. Do you or someone you know have tingling or numbness in your feet? What was the cause of these symptoms? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.